Good day everyone. So for today's video, I am going to perform the assessing of abdomen. So first is to reassess the client's previous medical records if available. Um, Prior to abdominal surgery or trauma may cause abdominal adhesion, thereby predisposing the client to future complication or orders. So next is to determine the scope of assessment needed um, and prepare necessary equipment. It is to gather relevant information while the patient seeks medical health care. Next is to perform hand washing and don gloves if deemed necessary. Um, this is to help protect against microorganisms. Also, by donning of gloves, it is where to avoid contact to blood and bodily fluids. So, here are my gloves, and I'm going to perform hand hygiene. Next is to assemble equipment and supplies needed. In preparing and bringing the equipment on the side of the bed, this conserves time and energy. So here I already have my equipment prepared. Next, introduce self and verify the client's identity. This is to ease any client anxiety, make the client comfortable, and allows you to make good impression and to ensure that the right patient receives the right assessment. So good day ma'am, I am your student nurse for today. I am John Ryan Esmaco. So what is your name ma'am?
So I am Angel Lisa.
Okay, so your age
19,
and your birthday.
March 23, 2000.
Okay ma'am, thank you ma'am. Then, explain to the procedure to the client. Discussion promotes reassurance and provides knowledge about the procedure. So, ma'am, today I am going to assess your abdomen if there are any unusual or unusual findings. So, ma'am, I just want your full cooperation to so that everything will run smoothly. Is that okay, ma'am?
Okay, sir.
Okay, ma'am. Thank you, ma'am. Then ask the client to empty the bladder before beginning the examination. So it is better to empty the bladder before beginning the examination to eliminate bladder distension and interference with an accurate examination. So ma'am, if you feel if you would like to urinate, you can urinate, ma'am.
Okay, sir.
Okay.
Excuse me.
Then, position the patient comfortably and provide privacy. This is to provide comfort and helps build trust. Also, the nurse can provide privacy by drawing the curtains around the bed or by closing the door to the room. So, ma'am, I want you to lay down, ma'am. This helps assessing you, ma'am. Then, let's just imagine that we have a curtain over here and just gonna close the curtain. Next, let's proceed now to the assessment phase. So first, observe the coloration of the skin. Then, note for the vascularity of the abdominal skin. So, ma'am, I am first going to drape you, ma'am. For your... So, okay, ma'am, I am just going to inspect your abdominal, ma'am. For your... Okay, ma'am. So next, inspect for scars for its length, shape, lines, and any specific characteristics. Also assess for lesions and rashes. So ma'am, I'm just going to inspect for any rashes, ma'am, any lines, okay, any scars, and so forth. Okay. Next is to inspect for the umbilicus. Also, note the color, location, and the contour. So, an inverted umbilicus is seen with an abdominal distension. So, So the umbilicus should be inverted not more than 0.5 centimeters and is round or conical. So ma'am, I am just going to assess your umbilicus. Okay, color brown. So next, inspect the abdominal contour. Sitting at the patient's side, look across the abdomen at a level slightly higher than the patient's abdomen. So, generalized protuberant or distended abdomen may be due to obesity, air, or fluid accumulation. Distension below the umbilicus may be due to a full bladder, uterine enlargement, or an ovarian tumor or cyst. So, ma'am, I am going to inspect your abdominal contour, ma'am. Okay. So next is to inspect the area between the lower ribs and the pubic bone. So ma'am, now I am going to inspect for your lower ribs and the pubic bone, ma'am. So, okay, ma'am. So next is to assess for abdominal symmetry and movement when the patient breathes. So also observe for peristaltic wave. So ma'am, I want you to take normal breathing, ma'am, because I'm going to inspect, and also for the peristaltic wave, ma'am. Okay, ma'am. Okay, ma'am. So now let's go to the assessing of the bowel sounds. So first is to place the diaphragm of the stethoscope on the patient's abdomen. Make sure it is warm. Also apply light pressure or simply rest the stethoscope on a tender abdomen. Then listen for at least 5 minutes before, because it is to determine that no bowel sounds are present and that the bowel are silent. And also begin in the right lower quadrant and proceed clockwise, covering all the quadrants. So bowel sounds may be more active over the elucial valve in the right lower quadrant. So I'm just going to warm first the diaphragm. Then I am going to start on the right lower quadrant. Map. Next is to auscultate for the vascular sound. So auscultating for vascular sound is very important if the client has hypertension or if you suspect arterial insufficiency to the legs. So first start at the right renal artery, then go to the aorta, then lastly go to the left renal artery. So always note to listen for venous hum. So, ma'am, I am going to auscultate starting at your right renal artery, ma'am, for venous hum. Then the aorta. Then the left renal artery. Okay, ma'am. Then next is auscultate for a friction, rub over the liver and the spleen. So assess the amount and distribution gas in the abdomen. So ma'am, I am going to auscultate for your liver and your spleen. So I'll start in the liver. Then the spleen. Okay, ma'am. Now let's go to the assessing of the tone and liver span in both lower and upper border. So first, percuss for the percuss for tone lightly and systematically in all quadrants. So I am going to percuss yung starting at the right lower quadrant. Okay. Next is to assess the lower border of the liver. So begin in the right lower quadrant at the mid-clavicular line and percuss upward. Then note the change from tympani to dullness and mark that point. And lastly, ask the patient to take a deep breath and hold. Then repeat the procedure. Remind the patient to exhale after percussing. So ma'am, I am going to percuss starting at your at the right lower quadrant, mid clavicular up, ma'am. Then I want you to hold your breath, ma'am, as I percuss you, ma'am. So inhale, ma'am. Okay. Exhale, ma'am. So again, ma'am. Inhale. Okay, ma'am. You can exhale na, ma'am. Now let's go to assessing the upper border of the liver. So first, percuss over the upper right chest at the mid-clavicular line and percuss downward. So mark that point. The next, note the change from lung resonance to liver dullness and also mark that point. Then measure the distance between the two marks of the liver span. Then repeat percussion of the liver at the mid-sternal line. So, ma'am, I am going to percuss you, ma'am. Again, ma'am. Pause at the pause. Okay, I'm just going to measure 2 points, ma'am. Ayan. Next is to percuss the spleen. So now, ma'am, I'm just going to percuss your spleen, ma'am.
Yes, sir.
Okay. So next is to perform the blunt percussion on the liver and the kidneys. So first is to percuss the liver by placing your left hand flat against the lower right anterior rib cage. The next is to use the ulnar side of your right fist to strike your left hand. Then percuss the kidneys at the costovertebral angles over the 12th rib. So, ma'am, I'm just going to put my hand here, ma'am, for the percussion of your liver and the kidney. So, ma'am, tell me if it hurts, okay, ma'am?
Yes, sir.
Okay. Okay, ma'am. Now let's go to the light palpation. So first, identify the areas of tenderness and muscular resistance. So using the fingertips in doing the palpation, start in the non-tender quadrant. Then next is to compress to a depth of 1 centimeters in a dipping motion, and gently lift the fingers and move to the next area. So light palpation is used to identify areas of tenderness and muscular resistance. So using the fingertips, begin palpation in a non-tender quadrant and compress to a depth of 1 centimeters in a dipping motion. So, ma'am, I am going to just press my fingertips here, ma'am. So also tell me, ma'am, if you feel uncomfortable, ma'am, or if it hurts. Okay, okay, ma'am. Now let's go to the deep palpation. So first, deeply palpate all quadrants to delineate the abdominal organs and detect um, subtle masses. So use palmar surface of the fingers to and compress to a maximum depth of 5 to 6 centimeters to detect tenderness and enlargement or masses. Next is to perform by manual palpation if you encounter resistance or to assess deeper structures. So, detect enlarged kidneys, gallbladder, and spleen. In a healthy state, these organs are rarely palpable. So, next is to palpate for masses. So, note the location, the size, the shape, the consistency, the demarcation, the pulsality, and the tenderness, and also the mobility. So, ma'am, I am just going to palpate you, ma'am, using the palm of my fingertips, ma'am.
Okay, sir.
Okay, ma'am. Next is to palpate the umbilicus and the surrounding area for swelling, bulges, or masses. It is used by the medical practitioners to determine the size, shape, the firmness, or the location of abnormality suggestive or of disease. So, ma'am, I am going to palpate on the umbilicus, ma'am, and around it, ma'am. Okay, ma'am. So next is to palpate the aorta. So palpation is essential to confirm that girth is excess fluid or the pitting edema. So certain physical appearance should always prompt an awareness of cardiac abnormalities. So use the thumb and the first finger or use two hands and palpate deeply in the epigastrium. So ma'am, I am just going to palpate you, ma'am. So tell me if it hurts na, ma'am. Does it hurt, ma'am? Here, ma'am. How about this, ma'am? Okay. Next is to palpate the liver. This is to find the approximate liver size, feel for tenderness and masses. So keep in mind that many of the findings of liver disease are found outside the abdomen. So first is to stand at the client's right side and place your left hand under the client's back at the level of the 10th to 12th rib. Then lay your right hand parallel to the costal margin. Note that your fingertips should point towards the client's head. Then, lastly, ask the patient to inhale. Then, compress upward and inward with your fingers. So, ma'am, I am now going to palpate your liver, ma'am. So, as I tell you to inhale, ma'am, you inhale, ma'am, ha? Okay, ma'am. Inhale. Exhale, ma'am. Again, ma'am. Inhale. Exhale. Okay, ma'am. Thank you, ma'am. Now let's go to the palpation of the spleen. So palpation and percussion of the spleen are very important techniques for identifying an enlarged spleen. So first, stand at the patient's right side, reach over the abdomen with your left arm, and place your hand under the posterior lower ribs and pull up gently. Next is to place your right hand below the left costal margin with the fingers pointing towards the patient's head. Next is to um, next is to ask the patient to inhale and press inward and upward as you provide support with your other hand. Lastly, document the size of the spleen in centimeters below the left costal margin and note for consistency and tenderness. So now, ma'am, I am going to palpate for your spleen, ma'am. So I'm just going to put my left hand over here, ma'am, and here, my right hand. So same, ma'am. I'm going to tell you to inhale, ma'am, and so ma'am, inhale, ma'am. Okay, exhale. Again, ma'am, inhale. Okay, ma'am. Thank you, ma'am. Next is to palpate the right kidney. So support the right posterior flank with your left hand and place your right hand in the right upper quadrant just below the costal margin at the mid-clavicular line. So the kidneys are difficult to palpate in men because first, resistance from abdominal muscle tone, and next is for more fixed position than in women, moving only slightly with change of posterior respiration. So next is to capture the kidney. So ask the client to inhale, then compress your fingers deeply during peak inspiration. Next is to ask the client to exhale and hold the breath briefly, then gradually release the pressure of your right hand. So, ma'am, I want you to sit, ma'am. Ma'am. Then I'm just going to put my, okay, ma'am, my left hand over here. Then, ma'am, I want you to inhale, ma'am. Then exhale, ma'am. Again, ma'am, inhale. Then exhale. Okay, ma'am, thank you, ma'am. Okay, ma'am, I'm just going to note this, ma'am. Then I'm going to assist you. Then, ma'am, to position. Now let's proceed to palpation of the urinary bladder. So begin at the symphysis pubis and move upward and outward to estimate bladder borders. So gentle palpation of the lower abdomen can detect an enlarged bladder, which is the most common cause of a midline abdominal mass in newborns. So ma'am, I'm just going to palpate on the upper pubis, ma'am. Okay. Ma'am. Now let's proceed to the test for ascites. So test for shifting dullness. So if low volume ascites is suspected, then an attempt to elicit the puddle sign may be performed. In some cases, the ascites collide to form a bigger ascites. This creates a different kind of shifting dullness. Next is to put the patient in remain supine position. Then percuss the flanks from the bed upward to the umbilicus. Then note the change from dullness to tympani and mark this point. So, ma'am, I am going to palpate here, ma'am. Okay, ma'am, can you turn slightly here, ma'am? Okay. Okay, ma'am. Next is to help the patient turn onto the side, then percuss the abdomen from the bed upward, then mark the level where the dullness changes to tympani. So, ma'am, I want you to turn onto the side, ma'am. Then I'm going to wait here, ma'am. Now let's go to the fluid wave test. So a positive fluid wave test indicates that there is a free fluid or ascites in the abdomen. So first, let the patient remain in a supine position. Then tell the patient that you need her assistance with this test. Next is to ask the patient to place the ulnar side of the hand and the lateral side of the forearm firmly along the midline of the abdomen. Next is to firmly place the palmar surface of your fingers and hand against one side of the client's abdomen. Then use your other hand to tap on to the opposite side of the abdominal wall. So, ma'am, I am going to need your assistance here, ma'am. So, I want you to put your hand like this, ma'am, your left hand, okay, ma'am? Then I'm just going to put it here, ma'am. Okay, ma'am. Then on the other hand, ma'am. Ma'am. Okay, ma'am. Thank you, ma'am. Now let's go to the testing for appendicitis. So appendicitis test help diagnose the condition so it can be treated before the appendix burst. So first, assess for rebound tenderness. So palpate deeply at 90 degrees in the abdomen, away from the painful or the tender area. Then suddenly release the pressure. Next is to listen and watch for the client's expression of pain. So measuring pain enables the nurse to assess the amount of pain the patient is experiencing. Then lastly, ask the patient to describe which hurt more, if the pressing or the releasing, and where on the abdomen the pain occurred. So, um, ma'am, I am going to palpate you here, ma'am, or near on the appendix, ma'am. Ma'am. So which hurt, ma'am? The releasing or the pressing, ma'am? Okay, no. Okay, ma'am. Now let's go to the testing for referred rebound tenderness. So palpate deeply in the left lower quadrant and quickly release pressure. So, ma'am, I am going to palpate on your left lower quadrant, ma'am. Okay. Okay, ma'am. Next is to assess for the SOA sign. So, ask the client to lie on the left side, then hyperextend the right leg of the client. So, ma'am, I want you to turn on your left side, ma'am. Then, I'm going to hyperextend your leg, ma'am. So, tell me if it hurts me, ma'am. Okay, ma'am. Thank you, ma'am. Um, Next is to assess for the obturator sign. So support the client's right knee and ankle. Then flex the hip and the knee and rotate the leg internally and externally. Okay, so I'm going to perform now. So ma'am, I want you to raise your leg, ma'am. So just tell me, ma'am, if it hurts, okay, ma'am. Okay, ma'am. Okay, ma'am. Next is to perform the hypersensitivity test. So stroke the abdomen with a sharp object or grasp a fold of skin with your thumb and index finger. So and also quickly let go. So ma'am, I'm just going to pinch you here, ma'am. So tell me, mama, if it hurts. you, ma'am. Thank you, ma'am. Now let's go to the testing for cholecystitis. So, first assess the right upper quadrant for pain or tenderness, which may signal cholecystitis. Um, then press your fingertips under the liver border at the right costal margin and ask the patient to inhale deeply. So, ma'am, I am going to tell you to inhale, ma'am. So, inhale, ma'am. Exhale, ma'am. So, last, ma'am, inhale. Exhale. Okay, ma'am. Thank you, ma'am. So, ma'am, I'm going to assist you on comfortable position, ma'am. Exhale, ma'am. So now let's proceed to the termination phase. So review the information obtained during the assessment phase and discuss the findings to the client. So present to the client the possible plans to resolve the health concern if present. So ma'am, so far ma'am, the assessment went well and there is no abnormalities on your observation, ma'am. So, next is to measure the client's understanding of the plan and the need for further teaching, then provide the client's opportunity to clarify, ask, or raise any concern. So, ma'am, do you have any questions about our assessment for today, ma'am?
None.
Okay, ma'am. Thank you, ma'am. Then end the interview politely. So, ma'am, thank you for coming, ma'am, and you can just maintain your healthy lifestyle, ma'am, ha?
Okay, sir.
Okay, ma'am. Thank you, ma'am.
Thank you, sir.
Then do aftercare. Fix the equipment used and arrange it properly. Then perform hand washing to prevent the microorganisms from spreading. So I'm just using the alcohol-based hand rub. Then document the findings in the client's record.